cup, and we're going to assume that this is the mother's breast milk, or it is milk formula. So we're gonna first assess the baby's respiratory rate for a whole minute, and the normal breathing rate should be 30 to 60 breaths per minute. So we have also assessed the previous amount of feeding that the baby can tolerate. So we're also going to be able to assess the baby's sucking reflex as they drink the milk or suck on the mother's nipple. According to the infant's chart, he is able to tolerate 30 ml per feeding, and the sucking reflex is assessed every previous feeding of the baby. So at the end of the procedure, the baby will be fed adequately, and the baby will be able to tolerate the feeding, plus the baby will have a good sucking reflex. So we have gotten the paper cup to be used by the baby from the sterile pack, and we're going to place it on the side table of our patient. We have also now checked the baby's name, if it is correct, on the crib tag and on the ID band that is worn by the baby, so it is verified and true. Name is Alex Cruz on both tags. So we're going to check first the name of the baby on the canister, the milk canister, and if it is correct, Alex Cruz, we're going to pour it into our sterile paper cup. So we have to take note of the amount and make sure it's not too cold or too hot. So we will now grab our baby. So we're going to use our non-dominant hand to support the neck of the baby. So we're going to carry the baby very carefully, and I have my hand on the back, and I will use my thumb and my middle finger to support the baby's jaw. And then we're going to grab the milk on the paper cup. So the baby is in a semi-Fowler's position, and we're going to just place the cup here. We're going to take note of the amount that we're giving to the baby. Do not force the milk on the baby, just let them sip on the milk. Okay. So at times we got to stop feeding to allow the baby to burp, and burping actually helps to stop regurgitation or backflowing. So we're just going to burp the baby in a semi-Fowler's position while tapping the baby's back with our dominant hand. Okay. So after feeding our baby and the baby has now burped, we're going to place the baby back into the crib, making sure that they are in a side-lying position to avoid any backflow or aspiration from the milk that they had just drank. Okay. So we're just going to dispose of the cup that we have just used in the proper bin, and also any other materials that might have been used in the procedure. So there were no significant findings, no abnormal findings. The baby was able to tolerate, so we do not need to report any significant findings. So we are now going to document the procedure and the baby's tolerance and reaction into the baby's chart. We're now going to evaluate the procedure. The baby was able to tolerate the feeding and the formula. There was no problem. Also, the baby drank around 20 ml of the 30 ml that was in the medicine cup, and the baby's sucking reflex is working and present.